Prime Minister Dickon Mitchell has declared his readiness to address the critical issues plaguing Grenada's health sector, even if it risks his political career. Speaking as a guest on GBN's Beyond the Headline Monday night, the Prime Minister emphasized his commitment to reforming the health system.
Developing
the healthcare system has to be comprehensively reformed.
No, agreed. But, just this receiving of help, both in terms of the voluntarism from the folks in diaspora and the accepting in Grenada, because that's an easy win and should be a low-hanging fruit.
Right. So I'm hoping we have an organization called GDAC, Grenada Diaspora Advisory Council, which has spent the last 2.5 years giving of the time and energy and bringing a lot of the medical professionals and so on in the diaspora together, whether from London, Canada, the US, and so on, who are ready and willing to go, frankly, at our request. It requires us, I'm saying here, the government, the Ministry of Health, Medical and Dental Council, hospital administration, staff, and so on, to put the necessary arrangements in place that could allow for these medical professionals to begin to come and for us to enter into a rotation process.
Prime Minister Mitchell highlighted the urgent need for systematic reforms to confront the entrenched cultural practices hindering progress in delivering quality healthcare services in Grenada. According to the Prime Minister, many times professionals are willing to give back but are faced with challenges created by those who work in the healthcare system.
Obviously, as the Prime Minister of the country, I am prepared to tackle the challenge. I am prepared to be voted out of office for speaking the truth. Because mark my word, if we don't address this issue, 5, 10, 15 years from now, it will be even worse. And I don't think we can hide by saying, if you poll the public, people are not happy with the medical services that they receive, whether it's the state of the infrastructure, whether it's the state of care, or whether it's just the absence of the specialists that are needed. So I'm saying we could either do nothing and continue the situation, or accept that we have a major challenge and go about tackling that challenge.
The PM noted possible ways to revert to these practices for the betterment of the health sector and the Grenadian people.
I think the entire medical fraternity in Grenada needs to address this cultural issue. I'm not a doctor, but I can tell you as the Prime Minister, we sometimes feel as if we are fighting against medical professionals sometimes to get them to receive help from their colleagues. And I'm unapologetic about that because it is the truth. Whether it's basic things like getting persons who are, and it's pro bono. Right. And so it's a culture that has changed. I don't understand why, because it seems to me it is presiding over failure. The healthcare system has to be comprehensively reformed.
No, agreed. But, just this receiving of help, both in terms of the voluntarism from the folks in diaspora and the accepting in Grenada, because that's an easy win and should be a low-hanging fruit.
Right. So I'm hoping we have an organization called GDAC, Grenada Diaspora Advisory Council, which has spent the last 2.5 years giving of the time and energy and bringing a lot of the medical professionals and so on in the diaspora.
Rena Thomas, GBN News.